go live. Thank you for being here. Hey everybody, it's another scorcher in my neck of the woods, and I'm guessing it probably is in your neck of the woods too if you're, in most of the country. So today is Wednesday, September 7th. Thank you for being here. And if this is the first time that you are catching me, maybe you were invited by a colleague or a friend to watch this video, please just pop a little comment below. Give me some likes and stars. Hello, Bernadette. Good to see you. Thank you for being here. So I'm going to be doing these quick hits. How to simplify your practice, especially because it's so hot. So it's all about working more graceful with less stress, less struggle, more ease. And we are ramping up opening enrollment for the Diamond Method, which is a clinical application, clinical approach for manual and movement-based therapists to get rid of pain, support their clients getting rid of pain and improving their function, their mobility, their performance, all that good stuff, their ease of movement, ease of life. So when we're helping our clients and our patients have ease of life, we need to have ease of life too. These quick hits, I'm keeping them just about 15 minutes or so, 10 to 15 minutes. So thank you for being here again. If this resonates with you, and if you'd like to share this with other people, please let us know, because I am going to be doing something special for people who share. So tag us to make sure that we know. You can do do hashtag Team Irene, and then that way Audrey will see it. Okay, so simplicity. It's all about the elastic waistband. I talked about that yesterday. In pants, elastic waistbands, no matter what your size is, no matter how in shape you are, it's pretty comfy. And that's why everybody hangs out in sweats or leggings or whatever instead of drawstring. So I showed you a pair of pants that I have. Yesterday I showed you the pair of pants that I have that I brought on my Europe trip that had a drawstring. And nothing wrong with drawstring, super easy as well. But elastic is easier, so I'm going to pull out the drawstring, put a piece of elastic in. That way, less fuss, simpler. I don't need to have a bulky thing around my waist. So why are we talking about pants? Because this applies to your practice. The clinical approaches, again, this is for manual movement-based therapists, the clinical approaches that work the best are actually the simplest. Now, I'm going to tell you a little story. When I started my practice, my degree is in rehab therapy, and I was a fitness trainer, personal fitness trainer, group exercise instructor, and I wanted to get my massage license, my certification. I was taught you never stop. Your hands are always moving. You're always doing something. You don't ever pause. That was what we were taught. Well, I'm here to tell you pausing is good. Sometimes less is more. And the clinical studies back it up. So what am I talking about? In the Diamond Method, we have what we call hand holds. Our hand holds, there's 6 of them in the whole method. One of them, the simplest, the first that everybody learns, is called the simple hold. Like literally, you're holding. It's not that hard. You have to know where to hold, so you find a sweet spot. So if you're watching this video, let's do it together. On your own self, find your neck. Fiddle around and gently press in, and notice if there's a spot that might be a little tender. Maybe there's a trigger point there. Maybe there's some restrictions. We call it a sweet spot. So usually I'll just give you a little hint, and this applies to our clients as well. The transverse process of the second cervical vertebra is often, because there's so many structures attached right there, and it's taking a lot of the strain and the stress of when we move our head, when we have forward head posture, when our shoulder is elevated, all that stuff. So if you just hit C2, and you might notice it's a little sensitive. So that would be what's considered a sweet spot. Now, everything we do should be helpful, not hurtful. Helpful, not hurtful. When you're having your dialogue with your clients, if you're applying the Diamond Method with them, be sure you're having a conversation We don't ever want to create more pain or discomfort or stress or anxiety or guarding or any of that stuff. So gently press in, find your spot, literally push in to what you would consider about a 7 or an 8. On a 0 to 10 scale, it should again feel comfortable, and just hold it. Just hold it. Simple hold is what this is called. And that's all. Now, here's the thing. When you're holding on your client's neck or on your own neck, you are aware. You as the client become aware of the sensation. You can interpret it, you can feel it, you can notice it, you can observe it differently than if the therapist was continuously moving. Moving's great, moving feels good, but sometimes less is more. Simplifying, reducing it down to the essence of touch, holding, letting the client, the person, you, if you're doing it on yourself, breathe and be aware and notice the change in the sensation. Optimally, the sensation would start to diminish. If there was any sort of element of discomfort, that starts to diminish. So our goal when we're working with people in pain is obviously not to create more pain, is to diminish their discomfort, their sensation, help them identify. This is a big piece that typical massage and physical therapy often misses. When you are doing something to your client, when you're the operator, when you're the provider of the therapy, oftentimes what's missing is the client's interaction and the client's participation. In the Diamond Method, it's all about partnering. We're doing this together. We're co-creating the results. So by you doing a simple hold, again, it could be anywhere. By doing a simple hold, what happens is the client's awareness starts focusing on that area, starts focusing on that sensation, and starts to release it. So less is more. Just simply holding that spot creates change in their body that oftentimes we've found is way more powerful, more impactful, more long-lasting, more comfortable for them than us going in and doing stuff and mushing around on them. Is this making sense? If it is, give me some love. I'd love to see that. And it would also help, of course, with the algorithms. So I appreciate you being here. And I do want to encourage you to think about simplicity. How can you apply that today in your practice? How can you help your clients see that they can co-create this change with you? They're part of the therapy. They're part of the approach. When you start doing something like this, it's just amazing because literally the changes come so fast, so quick, and they're so long lasting, as opposed to them being a passive recipient on your therapy table, your treatment table, or in the chair, wherever you're working with someone. So think about it. Simple is more, less is more. How can you be super simple? What can you do that helps your clients just stop, breathe, pay attention, focus, notice? We have the 7-step success formula with the Diamond Method. When you come and participate in the training, you will receive a card. I don't have one here. I should have brought one. But if you would like one, just leave a comment below and ask and put a little note in the comments, success card. And then that way we'll mail it to you. We'd have to get your address, but we'll literally mail it to you. Or if you want a digital version, it's the 7 steps that we use in all of our clinical approach. I'm happy to give that to you. So put in the comments. And if you're watching this as a replay, do hashtag replay. And if you share this with somebody, let us know, tag us so we can know that you're sharing it. Again, my goal for you is to try this today. If you have clients today, go ahead and give it a try. See if you can just hold the spot and do a simple hold. Nothing fancy. It's not complicated, You need to know where to do it. You need to know how hard to press in or how light to press in, and have them breathe and reduce the sensation. If the sensation goes higher while you're holding, then be aware of that, obviously, and modify what you're doing. In 2 or 3 breaths of theirs, the number should be able to go down from a 7 or an 8 is where you start, to about a half, 3 or 4. Once it gets to 3 or 4, you can move on. Your job is done in that area. Again, the awareness, the acknowledgement of the area, the sensation. When the client pays attention, the results multiply. You're co-creating your therapy. Give it a try. Let us know how it works. We are opening enrollment for our next training in San Francisco. Happy to chat with you about that. You get instant access to the online version. Some therapists, I think all therapists who've gone through the home study course have applied it to their practice even before coming into the live 3-day version and start getting results. So literally you can go through the training, you can learn the diamond method, you can start applying it in your practice, and you can start getting amazing results with your clients, supporting them for less pain, better improvement, and movement. If this was good for you, please let me know. I'd love to hear. It inspires me. I will be jumping in and doing these little quick hits, focusing on simplifying your practice and incorporating the diamond method. And if you like it, again, please let me know, and that will help me bring more value to you. Thank you for being here. I appreciate you. And again, thank you for sharing with your colleagues, your schools, your groups, your communities. I appreciate you. Take care. Bye for now.